So when we look at the behavioral model, as I mentioned in the video on psychoanalysis, it is a direct response to the psychodynamic perspective. Behaviorists believe that what we should be studying is directly observable behavior. Trying to tap into the unconscious is not physically possible. So there is that criticism about the unconscious. And there is a commonality between the two models. There's a concept called determinism. Determinism is the principle that everything is preordained, pre-established. There's no free will. So from the psychodynamic perspective, they believe in psychical determinism. And psychical determinism is basically those drives of sex and aggression. They're going to push us in a specific direction. There's no free will. And as it relates to behaviorism, there's more of an environmental determinism. You have an input and an output. You have a stimulus and a response. There's no free will. So from a behavioral and a psychodynamic perspective, everything is preordained. There's no free will. And that's going to be important because even this model gets criticized for the belief in the lack of free will. So, as I said, the behavioral model is going to focus on directly observable behavior and environmental factors or environmental triggers. So, we're also going to try and understand how learning takes place. How is a behavior acquired and how is it maintained through time? So, you're going to hear principles of operant conditioning, classical conditioning, observational learning, and that basically talks about the learning process, the acquisition process, and how behaviors are perpetuated through things like reinforcement and extinguished through punishment. So if we were to look at the behavioral model, here is where we see a very strong lab-based research model. So the conditioning of operant conditioning, classical conditioning, modeling, all of these were discovered initially in the lab and then applied to human beings outside of the lab and more generalized. But conditioning, which is a process of learning, we could learn both healthy, normal behavior and or pathological or abnormal behavior. So let's start with operant conditioning. Operant conditioning, there's a principle that a behavior is governed by its consequences. So in operant conditioning, you might hear about the ABCs: antecedent, behavior, consequence. The antecedent is what happened before the behavior occurred. We might view the antecedent as the environmental stimulus or trigger. The behavior is what the organism did. What did the human do? What did the animal do? And the consequence is whether or not that behavior was rewarded or punished. Now, I use two important words, rewarded and punishment. So you'll hear the word reinforcement. Reinforcement is designed to increase the likelihood of a behavior. So if you see a behavior and you want it to increase, you're going to use a reinforcement paradigm. If you want it to decrease, you're going to use a punishment paradigm. So punishment decreases the likelihood of a behavior. But whether you're using reinforcement or punishment, you're seeing the ABCs: antecedent, behavior, consequence. A behavior is governed by its consequences. So if it's a reinforcement, the behavior increases. If it's a punishment, the behavior decreases. Now, with operant conditioning, the person or animal directly experiences the reinforcement or punishment. What's different about modeling, which we refer to as observational learning, you're learning through the consequences of others. So if we watch people engage in a behavior and that behavior is rewarded, you are more likely to copy that behavior that you saw. If that behavior is punished, you're more likely to not copy that behavior, because we infer the following logic. Whatever reinforcement and or punishment another person gets, we're likely to have the same or very similar experience. So the modeling, if a behavior is reinforced, it doesn't come directly, it comes indirectly. So, and even improper behaviors can be reinforced through modeling. And if you study drug culture, it is not uncommon for people to, let's say, I don't know if they have an older brother, let's say they're dealing drugs. And all of a sudden, the older brother is flush with cash. They have a fancy car. That child is going to be like, hey, if I deal drugs, then I'm going to get a similar outcome. I'm going to have more money. I might have a fancy car. Now, that is not an adaptive decision-making process, right? It's not healthy to sell drugs, because you put yourself, your freedom, your legal status in jeopardy, and you put other people in jeopardy. But you can observe and model it. If I see a parent yelling and that gets someone to stop what they're doing, I might start yelling. But we also, can copy or emulate positive behaviors as well. So if you see a parent, let's say you're a young child and you see your parent going to school and working hard to get a degree, you will see that and say, okay, well, education is important. I'm going to work hard to achieve my academic or educational goals. So it's modeling, observing through the consequences of others. Again, I see something in the chat. What if morality is considered? Can you ask that differently, George? Can you unmute yourself and ask it the way you intend?
Yeah, so basically, I asked the question before you explained it. I got the concept, but I was thinking, I took lifespan development, psychology 242, and we discussed like how kids, um, regardless if it's moral or not, if something is rewarded, they would do it. But it depends. Are we talking here about like kids? Which phase?
It doesn't matter,
Are,
kids or adults. Adults engage in modeling too.
but even But adults, they have more like thinking process. They understand better that
Yeah.
there is moral behavior in
Yeah.
such decisions, even if it's rewarded, like critical thinking. But kids cannot do that
So
in such ways.
let me explain a little bit further then. So this concept of observational learning or modeling or vicarious learning, it originated uh, from the research of Albert Bandura. And Bandura did a study with young children in which some of the children observed an adult model engaging with an inflatable clown in aggressive ways. Other children saw the adult model just interacting with the inflatable clown, but in non-aggressive ways. And then there was a control group where they didn't see anything. And what Bandura found was several important principles. Bandura found that when children, after watching this videotape of an adult model, I don't know, maybe they punched Bobo, they kicked Bobo, which is an inflatable toy clown, through Bobo. When they went in the room, they did a direct copy of what they saw. Additionally, there were other toys that were not modeled for aggression. For example, there was a gun, right? So playing like the sheriff in town, like a Western movie. There was a toy gun. The adult figure did not model putting a gun to Bobo, but some of the kids did. There was a basketball. The basketball is used for shooting hoops, not using it for aggression. But the kids who saw aggression used the basketball to do it. Now, that's an important principle because you can have a direct copy of aggression and you can have variations of aggression. And younger children, it is true, are more likely to do direct copies of aggression when it's modeled. That is the reason why if a kid watches Power Rangers, a young kid, it's not uncommon for them to go into the playground and copy the moves directly from Power Rangers. Same thing with wrestling. But as we get older, our forms of aggression might change into more indirect ways. So our aggression might turn into road rage or verbal aggression. We saw aggression, we understood it as aggression, we copied aggression, not necessarily in a direct copy though. So modeling comes out of Bandura's work. Operant condition comes out of Skinner's work, and Skinner talked about all of the principles of reinforcement and punishment and whatnot, started out with an animal model and then generalized it to humans. We also have classical conditioning. Classical conditioning is the third of these. Interesting to note, our understanding of classical condition was before our understanding of operant condition observational learning. But with classical conditioning, you're pairing two stimuli together, right? So in the case of Pavlov's dogs, he linked a ringing of a bell with the presentation of food. Now, initially, ringing a bell has nothing to do with food, right? So dogs are not going to salivate by ringing of a bell. But if you present food, they are going to salivate initially because saliva aids in the breakdown of food and helps with digestion. But if I pair the ringing of the bell with the food, eventually I'm going to make an association between these two stimuli. And then ultimately, I might learn the bell to be a predictor of the food. And as a function of that, eventually, if I ring the bell by itself, initially you might start to salivate. Now, long term, that association is either reinforced by the two coming together, or that association can be weakened by removing that association. And I'll talk about that too. But if you look at classical conditioning, we have our top model with preconditioning. Now, I actually see that the slides are in reverse order. The tone should come before the meat, if that makes sense. So the neutral stimulus should be a predictor of. So I want you to correct that in your notes. And then ultimately, the neutral stimulus becomes a conditioned stimulus and salivation happens due to the tone. Now, that is the process of learning or associating two stimuli. Now, after that association takes place, we could say learning has been acquired, right? But we can also weaken the strength of that association through a process called extinction. And in order to extinguish a behavior, you have to present the conditioned stimulus without the unconditioned stimulus. So in the case of Pavlov's dogs, you would ring the bell, but not present the food. Remember, the original association was the bell was a predictor of the food. So now you're ringing the bell and not presenting the food. You're going to eventually salivate less, less, less. And ultimately, if I only ring the bell and don't present the food, you're going to stop salivating altogether. So if you look at panel 2 on the right, it goes to 0. You stop salivating. Now, the question you might ask yourself is, did the dog forget the association between the bell and the food? Or did the dog learn something new? And the answer is the latter, because we see if we wait time. So in this third panel, it's just time. So we give space for the dog not to have the bell rung. And let's say we do 2 weeks without ringing the bell. And then 2 weeks later, we ring the bell, the dog's going to salivate again. Now, if you look at the end of panel 2 and the beginning of panel 4, the dog stopped salivating at the end of the first extinction period. If the dog forgot the association, then it should stay at 0. But after a couple of weeks, they salivate again, not to the same strength. But again, if you only ring the bell, it's going to stop. Now, this is crucial because the dog learned sometimes I rang the bell and food came, sometimes it didn't. So in panel 4, it's kind of like the dog is thinking maybe food's going to come. So it's possible. So I'm going to salivate some. Now, if we are doing a therapy model, we can use extinction to our benefit. Because if you want to extinguish bad behavior or bad association, then you just keep presenting the conditioned stimulus without the unconditioned stimulus, and you'll uncouple it. So things like, I don't know, exposure therapy and fear of animals, right? So we might uncouple the trigger of fear with the presentation of the animal. So that's how it would work. So behavioral therapies, when we think of behaviorism, what is our goal? Well, we're trying to identify behaviors that are causing problems. So we refer to these problematic behaviors as maladaptive behaviors, and we want to replace them with healthier, more appropriate ones. And we can do this using all 3 of these models, or all 3 of these examples: classical conditioning, operant conditioning, and modeling. So I talked to you about fear conditioning and the role of classical conditioning. We might use operant conditioning when shaping a behavior with someone on the autism spectrum, right? So if we wanted to reinforce a certain positive behavior, we would use operant conditioning to get the child on the autism spectrum to copy a behavior or continue to strengthen that association. And if a person has a social phobia, right, or social anxiety disorder, we might engage in modeling to show how to engage in a social experience and then ask them to practice. So there might be modeling or demonstration as part of the treatment. Now, the therapist, in this case, you're more of a teacher. So you're teaching a person, okay, here's a skill, here's your trigger, here are some skills how to deal with that trigger. And then when you can cope effectively, you're on your own. You're ready to go. So the therapist serves more of a teacher model versus in psychodynamic, you're more of a gentle guide, right? So you'll see that it's very different. Now, what about early life experiences? Well, in psychodynamic theories, early life experience is very important because early life experience affects personality development. According to behavioral models, we focus more on the present to future And yeah, we'll take in information about early life experiences, but it's just to give us some kind of backdrop to where you are currently. But the model focuses on present to future. So let's talk about it. So we said classical conditioning, we're pairing two stimuli together. So in the case of phobias, we can use classical conditioning with a process called systematic desensitization. And if you're treating phobias and using systematic desensitization, it's an exposure paradigm, but it starts gradual and becomes more intense. Now, before engaging in systematic desensitization, it's very important to teach relaxation skills. So you might teach box breathing or progressive muscle relaxation, right? You would start with that before you even engage in the process of exposure. Then you develop a fear hierarchy. So we ask the client, okay, let's say you have a phobia of spiders. Give me things that would elicit greater or less of a phobic response. So we know physical exposure to a live spider is going to be an intense phobic response. But are there things that would be less intense? A person might say, yeah, looking at a picture of a spider. That might be the least, followed by a toy spider that is purple and fuzzy versus a toy that's lifelike. And then they might say, well, watching movies of spiders might be more intense. And what you would do is you would start with the least phobic response, so the picture of a spider, and then work your way towards eventually getting the person to handle a spider in real time. So that's systematic desensitization, but it profits from the classical conditioning paradigm of uncoupling the unconditioned stimulus with the conditioned stimulus. So it's useful in eliminating phobias. Now, let's look at the strengths and weaknesses of the behavioral model. One of the core strengths of a behavioral model is it relies on directly observable behavior. And this was a direct criticism of the psychodynamic approach. When we talk about research, one of the challenges of the psychodynamic model was it was hard to study the unconscious, but the behavioral model has very strong research support, significant research support. Now, what are some of the challenges? What are some of the criticisms? Well, the purely behavioral model, not the cognitive behavioral model, we'll talk about that. But if you're purely a behaviorist, you're going to focus on behavior to the exclusion of cognition. So if you were, I don't know, Skinner or Pavlov, you were in the camp of what's called a radical behaviorist. And you might say cognition doesn't exist. All we have is directly observable behavior. So a significant criticism of the behavioral model is it doesn't pay attention as much to cognition or the thought processes or mental processes in general. And examples of a cognitive aspect might be self-efficacy. Now, self-efficacy is important. That's our perception of how well we can master a task. Now, self-efficacy is not the same as self-esteem. Self-esteem is our broader sense of ourself and, whether our self-worth is high or low. We say about having high self-esteem versus low self-esteem. It's more general, whereas self-efficacy is learning a task. So if I wanted to learn computer programming, if I had high self-efficacy, that would B, I believe that I could master the task of learning computer programming. Now, that doesn't mean whether I master or not, I'm a good person or a bad person. My self-esteem is not uh, exclusively connected to self-esteem. If I had low self-efficacy, I might feel that I couldn't master a task, right? So I might not try as hard. So these self-efficacy are examples of cognition that a behavioral model might ignore that are important in our process. So there is a blending of thoughts and behavior. So you'll hear the approach called cognitive behavioral therapy. That is the understanding that thoughts and emotions influence behavior. It isn't just behavioral. So there's a connection between thoughts and emotions. Okay, so that's the behavioral model. And I'm going to stop the recording here.